I think, again, therapeutic combinations have already actually begun to be used. Some examples of this are combinations with chemotherapy, and you can see a well-known example of this is the RATIFY trial, where midostaurin was used in combination with chemotherapy. Midostaurin actually, as a first-generation FLT3 inhibitor, actually had no activity as monotherapy, or really very little activity as monotherapy, but in combination with chemotherapy seems to actually have a fair amount of activity and actually improve survival in a way that we have not seen in AML in 40 years. So really that suggests that it's these therapeutic combinations that are going to be most efficacious. And similarly, combinations with FLT3 inhibitors have been done with hypomethylating agents, and those seem to actually show a fair amount of response, a fair degree of response as well. And there are novel combinations such as with BH3 mimetics, such as the BCL2 inhibitor venetoclax. So I think these are the things that are coming down the pipeline in the next several years, but I think we're still not really sure that we already have drugs for the right targets. So I think really novel discovery pathways, efforts to really discover whether or not there are new targets that might be good synthetic lethal combinations with FLT3 inhibitors are what we're really focused on in the coming years.